itself. But to make it simpler, I will use my most recent experiences. When I was chairman of LPPKN, we did the second round of calculating Indeks Kesejahteraan Keluarga, the Family Wellness Index. So if you look at the 8 domains of those index, any of those 8 domains can be challenges. This include family communication, use of technology, socio-economic status is a very big challenge. B40, I think the number of B40 has increased. People are really suffering. So that's one experience that I had as to do the calculation of the Indeks Kesejahteraan Keluarga. The next one, I was one of the 12 experts for the Asian region to look at family, the year of the family, the month of the family this year, and I presented a paper on mega trends. So all these mega trends for families are really challenges. What are the 5 mega trends that we did in that committee? Mental health. We see senile dementia on the increase very, very clearly. I've never seen the incidence of dementia like this as I did when I was younger. Okay? Urbanization and migration are huge mega trends. But the two last ones that I looked at, which I think are real challenges, which are urgent for us to look into in terms of family, is technology and climate change. I think this requires a separate seminar by itself. You know about technology, the good, the bad, and the ugly. The good. And yesterday, when I saw CNN, Australia, West Scotty, Australia is going to pass a law to ban social media for children below the age of 16. That's how dangerous social media is.
So that's fabulous, Doctor. That is so neat. We need to do that.
Yes, I said. So it's really. And today, this morning, we heard about the different cohorts. To me, those itself is a challenge. How do Gen X relate to Gen Y? Gen Y relate to Gen Z, to the millennials. Now we have the Alpha generation. So I think I've used up my 2 minutes, so I will not speak any longer, except to summarize that this is a huge topic. We need a separate seminar to look at challenges facing Malaysian families.
Okay, if I can ask. Thank you.
Now, the how is very difficult, but we know the what, and you have described the what. So, during COVID-19, I happened to be the technical advisor for SRH at UNFPA. We conducted a study of 500 poor families in Kuala Lumpur, low-cost flats, to look at the implications and the impact of COVID-19 on these families. Of course, socio-economic is a real challenge. But because my time is limited, I'll tell you 2 things that I got responses from the 500 families that broke my heart. That till today, memang saya rasa nak menangis. The woman says, suami saya dah tak ada kerja. Dulu saya jual nasi lemak. Dia ni
husband's not working.
Macam kia kan?
She used to
sekarang saya tak boleh keluar rumah, saya tak ada duit.
She doesn't have money.
And anak-anak dah tak pergi sekolah, cucu saya kat rumah, saya kena bagi makan. Saya hanya boleh bagi dia telur dengan nasi setiap hari. I don't have money at all. And you know what that 10-year-old boy was saying? Saya ni, masa depan saya tak cerah lah kan? Sebab school is online. Kat rumah saya ada 1 je handphone, saya tak ada laptop. Jadi saya miss sekolah. So that really broke my heart. A 10-year-old boy thinking about his bleak future because he's poor and because of MCO.
That's right, thank you, Doctor. That's why it's very, very important, for us to show people that we are here. The children need to know that they can call us anytime, because there is no way that they can refer to their family members because of the situation that they're in, and of course the pressure if they talk about the problems outside. So when we are together like this, we go back and we share. We tell them, hey, we can support you. Hey, these are the people that you can go to.
I didn't do the how. So I said the how is difficult. But what I did after studying the findings of my study, I wrote a policy brief to the then Minister in Economy, Topa, one of the best ministers we ever had, to really look at social protection. So we had a few webinars and a few conferences looking at social protection and protecting the poor from vulnerable situations.
Thank you so much. Dr. Nora, would it be okay if you settled already? Will it become microphone?
Okay, maybe I would just like to add, in addition to what Dr. Narima has said, during our COVID pandemic, when it was during the pandemic stage, Ministry of Health actually set up a psychosocial support helpline. That was the first time that we set up. So as compared to in 2022 and 2021, there was a surge 5 times of numbers of calls. And 40%, we actually did a little bit of calculation. 40% of the callers had financial issues. So, which actually led to what actually Dato' said upon your study. We had calls at the back of the call. They were like periuk belanga, the pots were flying around, and domestic violence was also on the rise. And the children, basically, because they may not have access to the phones, but when we actually looked at it, as you said, as the ones who are staying in the flats or the apartments, they had to share, siblings had to share phones because they didn't have enough. And that one of the problems that came about was actually I had a very unique case that was brought right to me, because after the COVID pandemic, we had MCOs, and then we had the GKV cluster, task force and things like that. A lot of families who were frontliners, that means if your father is probably in one of the agencies who's also a frontliner, probably the mother would probably be a nurse in Jamana. The children, the older children became the third parent because Taska was closed, so the kindies was closed, they don't go to schools, they were online, and we find problems that now, after post-pandemic, we find that although we may not have enough evidence to say that the problems that the children are facing, but we find that a lot of children have adaptation problems. In terms now, sekarang dah bersemuka. So there are a lot of children, especially the young ones, even at the age of 6 or even 9, may have communication problem. Because at that point of time, they were PDPI, and assigning from homes. So a lot of social issues were actually relating to mental health issues. So those are the things that macam Datuk cakap, basically we are actually looking at the psychosocial issues that led to mental health issues. And now we are also seeing suicidal behavior. That's one of the things that is letting to one another.
If I may ask right now, what are some of the things that already perhaps that you or other associates are working on to help the children, especially that have gone through a really tough time during the pandemic?
One of the things that we are working for the Ministry of Health, we set up a committee to actually look into the agihan dana for the NGOs who's actually working with children, especially in BPR. So BPR
distributing of
funds for the NGOs, that too. So we've had I think for the last 2 years we've distributed about through the Ministry of Finance. One was actually 6.5 million to about 52 NGOs. But at the same time this year, I think after all these years, I have to actually acknowledge Yang Berbangga Datuk Narima for the one and only who brought me into mental health in 2005. Yeah. So Datuk is my sifu, saya tak boleh lari. So basically, Datuk was my sifu who actually challenged me to do mental health. Kalau tidak, saya tak berdiri di sini, saya tak duduk di sini. But yes, and I think at that point of time, we also developed what I remembered when Datuk said that, Datuk Narima said, and I want you to work on this. So this year, last year in fact, we have started to develop a plan of action for children and adolescents together with WHO and UNICEF. And the most recent is, I think, working with NGOs that we need to map out the NGOs. That means where are we looking into what target groups. Some are looking into the elderly, contohnya. There are some who's looking into the belia. So we need mental health. Ministry of Health cannot work alone. Yeah, that reminded me. We have only 2 minutes. Okay, so the final one is our help with adolescent thrive module that we are training the teachers in the primary school. So that is among the things that we are doing.
Thank you. So, perhaps you could also share with us. Yes, Sandabi has been very active in supporting mental health initiatives. Thank you for always supporting us for the last 4 years. So, what is it that drove you guys at YSD, to have strategic decisions by YSD to support MIASA?
Bismillahirrahmanirrahim. Okay, I am here representing Yayasan Sanabi on the philanthropy side as well as the donor companies, which are the Sanabi Berhad, Stigma 3 Berhad, and Sanabi Property Berhad. Now, I think for ourselves, we also learned very much about mental health back in 2020 during the COVID pandemic. So, we started off with some small, with a support for battered women and children, with Women Aid Organization. We've been supporting them for more than 10 years, about 16 years actually. We've been into women's rights and protection, and we heard how they actually attended to the cases of those women. And then we saw our own friends, colleagues suffered from that. And we also met like inspiring individuals like Datuk Ras. During the pandemic, I met MIASA, Anita, and a few others. And we collect all this data internally to try and understand how we can support, because we have the funds, but how do we channel it effectively? And that's when we started small with MIASA. Of course, with Dato' Raz is more on the persons with disabilities, but with MIASA we do a pilot hotline. So that alone, and also some funding for volunteers. So that alone told us that, hey, we need to have specific budget. We need to have a clear goal on how we can actually address mental health challenges, and that should be part of our community and health pillar. Because in Yayasan Sanabi, we have 5 pillars on education, environment, community and health, sports, and arts and culture. So we thought that why not we have a very clear strategy, and we embrace and bring along our donor companies. And some of them are here. I think Sanabi Motors, Razif, and those Aizat and also Yusmini are here all the way from Kulim. So we really want to do something, but this is something that we need to learn. What do we do? Like, how do we do it? So this is where connections, connected individuals yang inspiring, Dr. Anne, we met during the special task force. These are like really important information. And so from that small helpline, we now introduce the 24/7 MIASA YSD helpline. And that has been going on for 3 years. And there's a lot, it's a journey, so it's a lot that we need to do. And we want to support more, and that includes capacity building at the workplace and also for NGOs as well as volunteers.
Right. You're supporting all the causes for the community, but I also know this is 2024 and challenges pertaining to finance is also very big. How does a foundation like you work around to making sure that you're able to support all the different pillars and the teams out there who need CPS?
Yeah, but not only different pillars, we also understand that when it comes to mental health, it's a different spectrum and it's not one size fits all solutions. So you gotta have youth, different strategy, persons with disabilities, different strategy, and the workplace, different strategy. But to answer your question, with the limited funds, of course, because now we are facing economic challenges, you don't expect the GLCs out there going to give so much money. So even for Yayasan Sanabi, myself, I'm doing a lot of lobbying to tap on government grants, because a lot of NGOs don't know this availability of grants. So I know, because I have the connections, so what we do is we increase the pool. So I use my connection, we, Yayasan Sanabi and the companies use our connections to try and get better grant on top of our own donations. So I think that is the amazing thing about how the companies can multiply the availability of resources. And I also want to mention how like for example the companies because we have presence in all over the country, so we make use of those resources, and we are still trying to make it better. how we engage our own volunteers to try and see how we can add value to the mental health space.
Thank you very much to YSD. If I may, Dato, you touched about family much earlier when you spoke. Right now we're seeing the increase of mental health issues within families. And so how do you reckon we can work around this situation, to integrate mental health, more conducive and supporting not just the families, but also the carers, like all of us. Actually, half of us in this hall are carers, and the other half will probably be the ones who's struggling each day. So, what do you reckon would be best for us to move forward? Okay.
This word integration is not a very big word, but it implies a very comprehensive concept. And we in the I'm not in the Ministry of Health, when I was in the Ministry of Health, we were quite successful in integrating many things. And again, Dr. N is a very good example where I harassed her to do a lot of things, and we managed to integrate mental health. And Dr. Kadir told you this morning how I introduced community mental health, take it out of the hospital, and that requires integration. So integration is both vertical and horizontal. If you look at the vertical integration, how do the doctors at the health center refer to the secondary hospital, refer to the tertiary hospital? That's what, okay. Horizontal integration, do the specialists in the hospitals talk to each other in a cordial manner? Do psychiatrists talk with physicians, with obstetricians? Do they integrate? If I'm a gynecologist or an obstetrician, and I'm delivering a woman of a baby, and I discover or suspect that this person has depression, or going to have postnatal depression, what do I do as an obstetrician? Do I pick up the phone and talk to my psychiatrist? So that kind of integration maybe was not that good once upon a time. But we, Anne was working under me that time in primary healthcare, we make sure that there is proper integration. If an antenatal mother comes to the clinic showing depression, we get psychiatric treatment for her immediately. So integration sounds very small, but there's a lot to be done. And from my experiences, Ras Adiba, I am optimistic. I think we managed to integrate, first of all, family planning into family health. Later on, when I was working for WHO, I worked on a manual on how to integrate HIV/AIDS. Why should HIV/AIDS be standing alone in a silo? Why can't somebody who does skincare look the possibility of HIV/AIDS? So there's a lot to be done in integration. I think we can do it.
Thank you, Dato. I wanted to ask you, because I find that sometimes, people are working in silo. I'm talking about the ones in a medical profession. I don't know whether it's an ego thing, but I feel now that you've mentioned it, it's about time that we just, like open arms and work together, yes?
Let me just add, so when I was there as director and Anne was working under me, was part of the family health development. I remember a few months after I retired, she picked up the phone, called me on the phone, and she cried. I don't know whether Anne remembers it. Dato, they moved me from family health, now I'm under NCD. So now mental health is considered a non-communicable disease. And my advice to her, Anne, wherever you are, under NCD, under distribution, make sure that you look at the family. Your role is still integrating mental health into primary health care and the family.
Yes, Dr. Anne. So, despite the awareness campaigns that we are doing, ongoing radio, media, even social media, I find that it's still not enough. Yes. So, what do you think are some of the things that we should be focusing on? Because if there's just everybody scattered everywhere, the focus is not there, I think it's also pretty tough. So we need guidelines from the experts.
Okay, thank you, Ras. Basically, when we look at awareness, I'm quite sure that as compared to 2005 and now, after 20, almost 20 years, the awareness is there. The awareness is wide and things like that. But I think everyone, I do believe that everyone would agree with me that stigma remains still the main mental health issue that we need to address. Until we find a policy, for example, we are looking at whenever a person is actually goes to see a psychiatrist or being given medication for mental health conditions, regardless what it is. People will still look at, you have mental illness, so people are looking at you negatively. You know, although now I'm quite sure that a lot of people are talking, but we need to actually combat the stigma. So until a person we are aware, because look at it as a physical illness, like for example diabetes. Mental illness is depression or anxiety or even schizophrenia or bipolar. But if we are still stigmatizing, that means we are not acknowledging that when people have issues, with treatment you can work. So that's one. Yeah. But the other thing, when we look at awareness, what else needs to be done? We need to buy in the agencies and other ministries. For example, when we talk about the pyramid, kita ada base and then we have the tertiary psychiatrists. The base, that means the community, the working population, the majikan, that means employers, employees, and we're talking about if we need to buy in, we do not have enough social worker. So basically, what is there in the Ministry of Health is actually pegawai kerja social perubatan at the hospital level. But we need them to actually move, not in the Ministry of Health, but probably the Ministry of Women and Development, the biggest ministry with the ministry with the biggest number of social workers. Probably we need to look at it, because without the social worker, we now have actually moved into the counsellors. Kita ada counsellors at the ground, yeah. We have maybe not many counsellors at the field, and we have counsellors in the Ministry of Education, we have counsellors in the Ministry of Women, Family and Development, and at each organisation there should be at least one organizational counsellor. So itu counsellor. But when we're talking about integration, like what Datuk said, we integrate, yes, mental health into the primary health care, and at the hospital base we need to actually, that's why now we are training, for example, emergency physicians to understand, because they are the first liner to receive people with suicidal behaviour. Bukannya terus pergi kepada psychiatry. But even at that point of time, we need to do task shifting. So basically, the NGOs, the people at the community, so we have what we call as, we are embarking into a program what we call as K Mindset, Minda Sejahtera, yang we would love to train the community leaders so that they are the receiving end. That is one of the ways. So we need to move and do things differently.
Thank you, Dr. N. Well, we all know for a fact, being Asians, we don't discuss about, if we have problems, anxiety, depression, because, and then if anything, they'll say, oh my God, you're losing it, or you're crazy. So this is something that we need to change, and we have to create awareness by speaking about it. Like all of you, when you have the time, speak about it on your social media. But I also want to share something. During the pandemic, we, OK Central, our association, received a lot of calls from our friends from the 7 different categories, 6 actually, of the 6 categories, because the mental category, they're already there. But the rest, like physical, or autism, who has ADHD or autism, dyslexia and other disabilities, even deaf and blind, they've got another disability, which is mental. So now, double, as it is, it's already tough for us on our own with the present disability that we have. And after the pandemic, I have friends who went to the washroom, go to the toilet, autistic, severe, and the parents just say, go to the toilet and bathe, just play with water, and then this young man would just take his feces and eat his feces, or take his urine and drink his urine, because he's not in school anymore. So that's another issue that, perhaps maybe you'd like to share. How do we do this? I mean, I have all of you in here. Okay, most of you friends who are going through challenges in your own ways. But I'm the only one right here who's physical, so I can share. But my other friends who's going through it, it's already hard to speak about it because you're disabled, and then it becomes harder when you are, bipolar, or you are schizo, So how do we tell them, hey, it's okay not to be okay? everybody is going through it. Let's, don't worry about it. We'll do this together. How do we tell them that?
Back to what you said earlier on, the basic problem here is that big word that you use, awareness. Now, awareness is the first level of help-seeking behavior. Somebody will only seek help because they are aware. Saya perlukan pertolongan. If they are not aware, then we have failed. Ministry of Health has failed. You did not give health awareness. I think Malaysia is a country with one of the lowest health literacy. I work with the WHO, I work in many countries, and my health literacy in Malaysia is one of the worst. Okay? So somebody is aware, they will go. Some people are aware, but they still will not seek help. Why? Because it costs money. You need taxi fare to go to the psychiatrist. You need to pay to go to the private hospital. Psychologists are not cheap to come by. So financial barrier. As far as the government is concerned, what Anne was trying to tell you, in all the 2,000 clinics that we have, now we have, many of them have counselors, it is free. So in Malaysia, we have free healthcare. Financial barrier should not be an excuse for not seeking help. Then the third barrier is, they have money, they are aware, but they will not go because if I go, I will get stigmatized. People will look down on me. So this is a big problem which this conference is focusing on. I congratulate Miasa and where is Anita for having done this conference to look at stigmatization. Because I think it is still a major barrier why people do. Then the last barrier, and I don't want to talk about this last barrier. I am aware, I don't have financial problem, I'm not worried about stigmatization, I'm going to seek help. I go to the clinic, what do I get? I waited 3 hours to see a healthcare provider. The nurse was so rude to me. The psychiatrist did not treat me well. The medical officer did not even smile. That's what we call the patient-centered care is not available in many cities. So patient-centered care, which I think Roberto talked about this morning, is a very important component of making people go. So they must be aware, they must be able, and they must be treated well.
Thank you, Dr. for highlighting that, because that's usually something that we don't talk about. When we go to clinics or hospitals, we ask them, excuse me, can you help us? And it's like, I have experienced it before. I said, excuse me, can you please help me? I don't feel very well. Are you blind? And then she said, you're on a wheelchair, right? You're disabled, you're physically disabled, right? Are you also blind? She said, can't you see I'm busy? Can't you see there are a lot of patients there? And I said, yeah, but they say priority is given to persons with disability. I'm disabled. She said, yeah, I don't care. I want people to die. Can you just wait? And I'm like, dude, can't you say something nicer? Can't you say like, I would love to help you right now, but if you can give me a second, I'll tend to you. There's nothing wrong with being kind, right? So you know what? I always feel that in order, yeah, we have free, medical and stuff. So we are blessed, but we really need to train our people to be gracious and kind, because we're already going through so much pain, so much anxiety, so much stress, and the stigma too. No need to speak lah, okay? So yeah, these are some of the challenges, perhaps Dr. M. If you don't mind sharing with me on how do you guys handle this?
I think, okay,
Sorry, you guys experience this too, yes?
Wow. Habis Ministry of Health. Kena cakap, kena tweet dekat YB Zul. Okay, I think one of the things that, on my part, because of course I've heard about this, but of course kita dalam the whole of the environment, the whole of the healthcare facility, I think one that we need to actually, we have to walk the talk lah. We have to be kind, of course, we have to talk nicely, that's one. So basically, I suppose, even I think there are a lot of doctors from the Ministry of Health is here, psychiatrists pun ada, kan? And I'm sure that we faces different kind of situations. I mean, when I had my late mother having dialysis, we will also have that. But we understand that, not to say we understand, we feel that yes, the healthcare workers are also probably burdened, but that does not give an excuse for anyone, doesn't matter, to be rude. Itu satu lah. So I think the only thing that probably on my side as the National Centre of Excellence for Mental Health to ensure that our healthcare workers need to be trained on also self-care and also to practice our budaya corporate lah yang sejak I think semenjak Datuk ada kan, penyayang, caring, professionalism and teamwork. So inilah, so we have to break the silos, we have to talk to one another. So I think having said that, I've got no defense to say, but basically we need to improve the situation.
You know what we always say, when they speak to us like that, when we go to the hospital and they speak to us rudely, we say like, the nurse is also disabled. That's why the nurse is speaking to me like that. We pacify ourselves by making excuses for them, but for how long can we make excuses? Yes. Yeah, because and that's why I think it's also it's vital that we look after the team who's up the frontliners, because they burnt out.
Definitely.
They're burnt out completely.
Just to share with you, Ras, basically when I went to visit my auntie in one of the hospitals in Malaysia, there were two doctors. One of them was explaining about my auntie's condition. Another one was like, I have to do this, I have to do that, and start moving and start, hurry up. But somehow or other, when you talk about burnout, so the only thing that sometimes we need to ask, because at that point I did introduce myself as a person working in the Ministry of Health, but I just asked, excuse me, doctor, how are you doing? Are you okay? And she cried. So basically, I think a lot of burnouts are going about there. But as I said, it does not give you the excuse to be rude. But we probably need to train our healthcare workers on mental health to understand, because I think given that mental health literacy is also, we have not had any studies on mental health literacy, Datuk. We are doing it this year. The Dasar Literasi Kebangsaan for the Ministry of Health is considering also to incorporate mental health literacy, inshallah. But I do believe that if we train our healthcare workers, because the nursing, we are going towards this Madani is supposed to be effective, efficient, and we are supposed to not, if there's complaints, we're not supposed to just shut it out. So we have to actually improve. So that will be, I will try to do that on my capacity sepanjang beberapa tahun lagi Datuk ada, insyaAllah, for a few years more that I'll be in the Ministry of Health. I will try to work on that, insyaAllah.
Thank you. If you need support, I'm around, and we're all around.
Yeah.
So let's make the environment a better place, especially people in the workforce. Yes, Pujan, please share with us your thoughts.
So I just want to, when we talk about, for me, the most important thing is really want to normalize the conversations on mental health. Not only talk about policies and framework, but how do we translate those into actions on the ground. I give you an example. When you talk about social media, I think many times people talk about all the bad things about mental health, but lack of people, not many stories that talks about the successful recovery from mental health. Like how do you, persist and that resist, resilience, and how you come out from there, which can become inspiring. And I think that is really, we need to do up more. We get more social media influencers and media to talk about it in a positive light. I think that's important. When you talk about translating grassroots action, really also sometimes in the space of workplace. We have the leadership. Leadership kata, we want to do mental health wellness for employees. But sometimes they don't know how. You have a statement, but how do you translate that into actions like, on psychological safety? Where the workplace culture, people running to cakap no. When it's too much workload, for example, how do you say no? And those are skills that need to be learned by the immediate superiors and managers, because they want to support, but they just don't know how. And those kind of training, I think, is also quite, I'm sorry to say, quite lacking in the HR space and also the Ministry of Human Resources. If we can improve that, then those skills can also be learned for their families as well. So I think that kind, and I think another thing that we really like about, in the setting of mental health, in the setting of workplace is volunteerism. Because I think volunteerism, it's not about empowering individuals to seek help, but it's also the communities, they themselves uplift one another. They themselves help others. Because when we help others and we volunteer, it becomes like a how do you say? It's like a reflection. And perhaps that can also be like something that is motivating them to come out from that mental health issues, and also can remove the stigma. Yes.
Thank you, Muja. Okay, I'm actually not following the question, that we've been preparing. I think this is really hot as well. So, Dato, initially, when we started to speak in the beginning, you mentioned about dementia as well. My mother has got early dementia, and I can see that she's already somewhat, drifting a bit. So in 2030, Malaysia will be an aging population. In 2040, will be a full-fledged, aging country. So how are we supporting that? We were talking about we don't have enough psychologists, psychiatrists, we don't have enough occupational therapists, physiotherapists. What are some of the stuff that perhaps the both of you later could share? What are we doing to make sure that we are preparing the country towards that? Because to be very honest with you, there's only a couple of years down the road, and we're not ready, and we're in deep trouble. And dementia, Alzheimer's, they also fall under the OKU category, and they will need psychiatric support, psychological support. So what are some of the stuff that perhaps maybe there's already a plan?
I think I cannot make it very coherent this afternoon. A lot of things are going on, but I must get my thoughts in order. Okay, Razaniba, the first reality you have to accept is we are aging. And like other countries in the West, they became rich, then they became old. We are becoming old and we are not yet rich. So we are poor, middle income, high middle income country. So the government is facing a big problem of population aging. That's the first harsh reality. The second harsh reality is kita selalu, sorry I have to speak in Malay, about family, sorry Roberto. We are very proud, we are Asians. Unlike the Westerners, we value family life, we look after our parents, you look after your mother. This is not going to be a reality for long. My children probably will not look after me when I'm old and disabled, not because they don't love me, but because there's so many other things to do. So the harsh reality is that the family cohesiveness is slowly dwindling. So that's the situation. But Razani, your question is very, very difficult. So what are we going to do about it? When I joined UNFPA, I told UNFPA, look, you are giving so much money to WAO, for violence. We give a lot of money to my aging, to do studies. You've got so much evidence, you have enough. If you give me this evidence, I know what to do if I were the Prime Minister of this country, but I'm not the Prime Minister. Can you translate all this evidence, thousands of evidence, into real action? We are slow in that. For some reason or other, translating evidence into policies into programs into activities is a tough battle for us. So one of the things that we have done, let me think now, we have got a population aging national plan of action. Things are in place. So there are strategies, there are activities that people from all walks of life, I can't remember exactly the details, but everybody has a role there. The politicians, the policymakers, sometimes they are the most difficult to change, and then program managers like Anne, the community, NGOs, and foundations and the private sector. I'm so glad to have met Muzalifah today. She has really epitomized to me PPP. We always talk about PPP. We seldom see it. After meeting you, I know the public-private partnership is strong. So I think there are plans of action, but I can't remember offhand. There are plans of action.
Dr. Anne, would you like to share with me?
Maybe because it falls under the ministry yang mana Datuk Narima is the mantan pengarah, director. I think we do have a plan of action for dementia that is already in the pipeline, Datuk, dah ada. And also I think the Ministry of Women, because at the agency level, if you have certain plans or certain policies to be actually passed on, they will be presented at Majlis Sosial Negara. So although for mental health, we presented once on how do you address suicidal behavior, so among the agencies to actually buy in the other agencies' responsibilities. So I think similarly for aging, I think I believe that we need to work together, because macam we need neurogeriatricians, and just to share, one of my relatives, a very close relative, and also my auntie, who's actually bedridden now, started off with dementia. So even, and one was diagnosed with Alzheimer's. But I think one of the things that the support given to the caregivers, especially when you have a husband and wife, probably with maybe one single child, and they have to actually take care, the wife has to take care of the husband who's actually showing early signs of dementia. So basically, the training or the awareness for the caregivers, especially as we go along the road, okay? Because now I do see that I came from an extended family. So I lived with my mother and my late father and my late mother, and my two in-laws passed away when I just got married. So basically, living in an extended family, actually also you have to take care of your mother, because my mother was bedridden and things like that. So basically, when we talk about dementia, the support for the caregiver is important. So that is where you need to actually get hold, not just with the government, but also with the NGOs supporting on how do you take care of the elderly. So that is one of the things that we're doing.
But okay, I think the most important thing is about being Asians, we're very privileged, yeah, because we have extended family with us, and we've been trained to look after our other family members who's aging or going through a certain health condition. I became disabled halfway through my life. When I was disabled and paraplegic, I had two of my boys. They both came from my heart. So this particular one, especially the one right in front of me, Umar, looking at you, he didn't care. Umar, can you please stand up? Umar, stand up. They want to see you. Umar is 17. Umar is on the spectrum. His brother is ADHD. So I've been very blessed and privileged to have them in my life. Thing is, Umar had to grow up fast. He didn't care. When he was a baby, he was a child, he loved me like crazy because I had wheels. It's like his bicycle, he was pushing around and everything. He didn't discriminate. So until now, he's got this thing, everything he has to look up for me, Sometimes I feel really bad, but these are some of the things that we must train our young ones. Monkey see, monkey do. Yeah? If you're kind, you're gracious, you look out for one another, then they will grow up and to look after others. So I think this also, we have a big responsibility to tell our children, hey, you know what, when we grow up, you guys, we looked after you. It'll be nice if you learn how to look after us. I mean, some people say we don't do this in Europe, in America. We don't look after our elderly. When we're 17, 18, they kick us out. But we don't do that here in Malaysia. So the younger generation, Dr. Dato, Mujar, they are the ones who's going to carry the flag for us. So what do we do? How do we tell them this is the reality? We're not going to be here forever, but hey, we're just going to be with you, and you're going to learn so that your children will be able to look after you if anything was to happen. Role models, yes. So perhaps maybe you can share how can we work about in having the younger generation understand, because in order for Malaysia to move forward, we have to make sure that they're on the bandwagon as well. They know how to support. When they have to, we must educate them. So yeah, I think we should be just speaking about ourselves, our age, but we also should speak to the younger generation as well, bring them together and say this is how it works, this is how it works.
I would have a very very short answer for this because I'm not really an expert yet. I'm not a very successful parent myself, I suppose. But yeah, I have great children. Two things here. Number one, we as parents, we must understand what these generations mean. So understanding and knowing what they are, how they behave is the first that you must understand. The second thing is what I was telling you earlier, we must be role models. If you want your children to respect you when they're old, you must show them how you respect your own parents. So these are the two things I can think of offhand. But maybe the other two panelists have more things to share.
I also agree, I think it's the education from parents is very important because that gives the values. People don't talk about values anymore much these days, but values is very important, the upbringing. Whatever it is, I think I also want to give credits to, when you talk about PPP, I want to give credits to a lot of organizations who have done collaboratively with the ministry on doing programs on the ground for school children. Because they already have mental health awareness and trying to train the counsellors in schools. For us, our future, when you talk about early intervention, we do have programs for youth. We have independent programs, like helpline service kind of thing, training for the persons with disabilities at young age, as well as our scholars. So that I think that those are important information and knowledge that they need to gather right now at the young age for them to bring back as a leader. As for I think parenting is really important. Whichever social issues that we're talking about at the end of the day, and it's not just about those who already have children, but those who are about to get married, those who are planning to get married, or those who are even at a younger age, they should actually know about parenting when they are at a suitable age, because parenting right now is really challenging. And like Dato said, it's really cut across different generations. So you don't talk like how I got that education from my parents. And I think we need to have that humility and the openness, because sometimes even if you teach a lot with a lot of information, they cannot embrace it with an open heart. And we are living in a really challenging and dynamic world where things keep on changing. Our kids are now talking on different language. So it's really important to also keep ourselves updated as parents.
On that note, Razadiba, RPPKN has a very nice module for before the parenting for couples who are getting married. It is called Smart Start. I think it is called Smart Start. It's a very good program. How to teach future parents on what marriage is like and what parenting is.
Maybe I would like to add one of the things that if we look at the generation of how we can actually educate our younger generations, one of the things that I think I would like to stress is connectedness. That means our connectedness, our communication with our children. Because nowadays the children does not communicate like before. You can't be telling them, for example, when I was at your age, that doesn't apply to the younger generations. Yeah, you did. Okay, so that is one that a lot of still are actually looking at how your parents parent you. So that shouldn't be the case. Then I think also another thing is we have to incorporate being at the policy level. I feel that we need to incorporate, as what Dr. Narima has said, LPPKN ada module. But of course, when we go for kursus perkahwinan, you go under JAKIM. So we need to incorporate, walaupun modul kekeluargaan tu, what they teach is actually about non-smoking, cooking and things like that kan. But we need to teach them about conflict management, because conflict management, problem solving for the ones who are about to get married, because that we do not have to see people who are getting married after 2 years divorce. Kita tak nampak macam tu. So hopefully that we can actually, because I know that JAKIM, Yadim is also looking into the family module. So I think Ministry of Health is opening our doors. We have opened our doors, but probably we need to work more. And I do believe that when we open our doors for public-private partnership, I think even our Minister, Wabizul, has actually announced about the Rakan MOH, one of the things that we should be seeing soon, hopefully. So I met Muja masa GK Vitas, so she was very kind enough to donate many things during that pandemic. So I think we hope that this year kita ada NCMH, National Centre of Excellence for Mental Health and Yayasan Hasanah grant for NGOs. So we have received about 106 NGOs that we are looking into, including Miasa, inshallah. So hopefully we will work together, inshallah.
Okay, now we have questions from our audience, our participants, to Puan Muja. The question is, where or how can we know more about grants, especially NGOs who really want to do more for the community out there?
Okay, they're very easy. So you just go to www.assigndami.com, or you can just reach out to our social media, or you can just ask me. So I think very important is you need to be very clear about what you want and have a budget breakdown. And also, I think very important is what do you plan to achieve, your deliverables. But I think most importantly is to first go to the website to understand the causes and the strategies that we support. And if it's aligned to your organizations and it's a win-win, you think, then you can just put up the application. Yes.
Thank you so much. And to Dr. Nalima, you've gone through so many experiences, which makes you extremely inspiring. How do you yourself personally take care of your mental health? You are there for everyone, but yourself?
Sometimes I ask myself, am I mentally normal? But I know the fact is none of us can claim to be normal. All of us are on a spectrum. Actually, I'm a neurotic. Okay, to answer your question,
Thank you for being honest.
I think to answer that question, I think a lot has to do with my personality. If you notice me, I'm very open. Somebody even said, you know why you never succeeded in the promotion? Because not only are you of the wrong gender, why are you a woman and why must you be a loud woman? So I am loud and I'm very open, I don't keep secrets. So that is my personality. To give you an example, when I was diagnosed with breast cancer, just after I retired from the government in 2007, I know of breast cancer patients who said, please don't tell anyone I've got breast cancer. I don't want any visitors. The first thing I did when I was diagnosed was I underwent the surgery. I told my husband, I married a foreigner, my husband is from India. I said, call all my siblings, call all your siblings in India, tell my Ministry of Health, tell my staff in WHO, I was already working in WHO, and tell my old TKC, because I'm from the school called TKC. So these 5 groups, you must tell them. So my husband told them. And when I came home from my surgery, what do I see? I saw 60 women in my house doing sembahyang hajat for me. Then my brother-in-law, who's a Hindu from India, from Gujarat, said, we went to the temple, 70 people came to pray for her. I've got a doctor, Rachel Koshi. She is a Syrian Christian, a Malayali. Rachel said, Dato, me and my parents and all my cousins, we went to church yesterday to pray for you. I've got Sister Chio who was working for me, and remember, working Dr. Amina, Chio said, Dato, I'm a very devout Buddhist. I went to the temple and lighted a candle for you. You know what I told myself? Oh my God, God gave me this disease for a reason. For me to know that I'm being loved, which I took for granted. But to add on to my story, at one time, I ran out of vaccines. Somebody in Kelantan said, Dato, I need money to buy DPT vaccine. I ran to the KSU. Dato, please give me money. I need money for DPT vaccine. Sorry lah, Dr. Narimah, can you wait until September when the next tranche of budget comes? I cannot wait because vaccine has to be given at a certain age. She said, can you go back and look at your budget? You ambil dulu whatever you have, I'll pay you back later. I didn't tell you any story. I went back to my office, called my financial club, looked at this, said, okay, I need to buy vaccines. I had to steal money from somewhere. Where did I steal it from? Breast Cancer Awareness Program. For 3 years, I did not do breast cancer awareness. No wonder I got breast cancer. Oh shit. But I was saving babies' lives. But I told dear God in heaven, if you're punishing me, please remember, I didn't do breast cancer awareness because I was saving babies' lives. So number one is my personality. Number two, I think is, I don't know, I got a very, very supportive family. My husband is a burden to me because he is such a good human being that my friends tell me, why did God give this man to you as your husband? You're so nasty, you don't even deserve him. And that's how good he is. And I've got children who really support me. So that's how, and today, I'm going to be 74 very soon. I know my frailty. So what I do is, now that I'm fully retired, I'm practically jobless. I don't want to make any of you feel guilty here. I walk 6 kilometers every morning.
Wow.
Alhamdulillah. Yeah, I mean, thank you, Dato, for bringing that story. Basically, I think one of the things that I would like to say, if we go back to the mental health definition, Dato, is about knowing your potential, be able to cope with the normal stresses of life every day, be able to work productively and contribute to the society. So on my part, I always believe that when you are being put somewhere, there is always a reason by the Creator. Whatever happens to us, B yang saya buat bersama arwah Datuk Dr. Sharifah, who's ni Datuk, the first B in 10B for managing stress is bersyukur, to be able to be grateful. So itulah the reason why I always believe that I'm put here, although my initial cita-cita, my ambition was never to be a doctor, Datuk. I wanted to be something else. And but the reason why you're being put here, inshallah, there's always a reason. Ada sebabnya, inshallah.
Well, with that, we end our conversations this afternoon. It's crazy, right? If only we can speak some more. I mean, like, a lot of secrets here. So, but we are going to leave this hall into the evening with so much love, experience, but most of all, blessed, because the sharing that the three of you have, done with all of us have somewhat make us more alert, more aware of what we are all about, especially Dato' Lan. There's not many people who call me Ras Adiba. You get away with it because you can't, So, but thank you so much, ladies. Women power here, I'm sorry, there's 4 of us. So we hope you've enjoyed the session, and inshallah, we are around. If there is anything that you need, please reach out to us, inshallah. Thank you very much. Assalamualaikum.
Thank you so much, Dr. Azadiba. There was so much honesty and it was so raw and so pure. So it was really, really good forum today. Thank you so much. Okay, I would like to invite Puan Anita Abu Bakar on